Press a button on your hand controller. This button opens the patient interaction menu. Press the button on your hand. This button opens the documentation menu. Press the primary trigger button using your middle finger. This button allows you to pick up any object. If you release the button, the object will go back to the original position. Press the index trigger button using your... This button allows you to perform any action with the object you are holding. If you release the button, the object will go back to the original position. Have you understood the buttons and their functions well? Now, take 15 seconds to memorize the buttons on the controller.
So the task has been completed, and I can see that you may require eyeglasses. Anyway, it shows you a refractive task to complete.
Congrats. Great job. Now move your right hand towards the syringe and press the middle finger to grab it. Now press the index finger to apply the bulb of the syringe. Tutorial has been completed. Thank you.
Thank you.
Today we will learn about capillary blood glucose. A capillary blood glucose test is a blood test that screens for diabetes by measuring the level of glucose in a person's blood. Normal blood glucose level, while fasting, ranges within 70 to 99 milligrams/dl, 3.9 to 5.5 millimoles/adult. For interacting with a patient, press A. Touch and hold the button to select.
Hello, I am Dr. Sam. I will be assisting you today. Hi, doctor.
For explaining the procedure, press A.
I will be taking your blood glucose. I will use this
yes.
to prick your finger and then take the sample. Okay.
For verbal consent, press A.
Can I go ahead with the procedure, sir? Sure. Go ahead.
Go near the wash basin. Place your hands near the sensor to wash your hands. Go towards the patient. Wear the gloves. Now we are going to learn about the glucometer. Tap on the button. A glucometer is a medical tool that is used for measuring the approximate level of glucose in the blood. Now we are going to learn about glucometers use electrochemical test strips to measure glucose content in blood. Each glucometer test strip contains an enzyme called glucose oxidase. Glucose in the blood plus glucose oxidase gives gluconic acid. The gluconic acid thus formed then reacts with another chemical in the testing strip called ferrocyanide. Ferrocyanide plus gluconic acid gives ferrocyanide. As soon as the ferrocyanide has been formed, the glucometer runs an electric current through the blood sample on the strip. Pick up the glucometer and insert the strip in it. Place the glucometer in and hold the patient's index finger with your left hand. Pick up the alcohol swab and wipe the tip of the patient's index finger. Discard the alcohol swab in the yellow bin. Now we are going to learn about the lancet. Tap on the N button to get started. Avoid pricking the pad of the finger because it contains more nerve endings which will be more painful. It is important to use a new needle or lancet every time. Pick up the lancet and prick the patient's patient's index finger.
Ya que Cari mana tu? Kalau mana?
Discard the used lancet in the sharps box. Now we are going to learn about cotton ball. Tap on the end button. First few drops of blood on plaster which and hence will not give an accurate reading. Wipe the first few drops of blood with a cotton ball. Discard the used cotton ball in the yellow bin. Press your left hand index trigger to squeeze the patient's finger. Now we are going to learn about glucometer calibration. The glucometer is calibrated so the number appearing in its digital readout corresponds to the strength of the electrical current. The more glucose in the sample, the higher the number. Bring the glucometer with a strip to the drop of blood to record the reading. Wipe the excess blood on the patient's finger using an alcohol swab. Discard the alcohol swab. Remove the strip from the glucometer. Discard the strip into the yellow bin. For documentation,